So I have here our ortho model, and I kind of wanted you to get a sense for what it is that we kind of do when we're doing ortho. So kind of looking at some of the um, things that we're going to be using as far as the arch wire, some instruments, some ligature ties, so you have an idea of what it looks like. Before we get started with that, I do want to show you again our ortho wire, and I don't know if you can really see or not. It doesn't really look like you can, but in the center of this arch wire, it shows that there is an area that is black, and it's right here in the center. You can kind of see it right there. And what that indicates is that is the that's going to go right in between the two centrals. So this is going to be your midline. So you always want to make sure that you're looking for that, whether it's black or red or whatever color it is, so you can kind of, when you're placing it in, you know where to align your arch wire, because that's always going to go in between the two centrals. So one of the pliers that your book talks about is the Howe 110 plier, and you can kind of see the way it looks. It almost looks like it has a little bit of a paddle to the ends of it, and the way this is going to be used is to bend the arch wires. There's going to be times where the orthodontist is going to have to do some specific bends within the arch wire. It could be due to maybe some of the teeth being crooked. So to be able to accommodate the arch wire to fit over it, especially if it's more of the stiff arch wire, it's not going to have as much give to it as it normally would. So they're going to have to make some specific bends for it to fit appropriately onto the teeth. So that is what the Howe 110 plier is going to do, is it's going to allow for those bends within the ortho arch wire to be made. So that is the 110. Again, kind of has the paddle ends to it, and it is serrated on the inside, and it just allows for the arch wire not to slip out. So when it comes to placing the arch wire, first thing we'll have to do, and this can be done using a variety of instruments. What I used to do when it came to removing the colors, as some people refer to them as, or their elastomerics, I would always use an explorer. It was just a lot easier for me to do that. So with that, you always want to go away from the gum tissue. You never want to go this way, because if you slip, you have you run the risk of injuring the gum tissue. So you always want to kind of go towards the incisal or occlusal, depending on where it is that you're working. And these are kind of breaking on me as I'm taking them off, because they've been on here quite a while. So I'm going to take a few of these off so that you kind of see. So you kind of just get your explorer down in there and then take them off. I'll do one more here. And we can kind of get a sense now of what that looks like. So here's our arch wire. Again, it's if I were to take all of these out, this arch wire would just fall out. So we want to make sure that we keep that arch wire in. So that's where the colors or the elastomerics come in. And like I mentioned before, these are ceramic brackets, so they are tooth colors, so they're a little bit harder to see. When I did ortho, I hated working with the ceramic brackets just because they are so bulky that it was hard sometimes to get those elastomerics around them, and oftentimes, as you saw when I was taking them off, they would just break because you had to really stretch them over it. So these are the ones I hated the most to work with, were the ceramic. So thankfully we didn't do a whole lot of ceramic brackets. So if, once we would select our arch wire, obviously, that we would want to do, and then this is where we would allow the patient to pick their color that they would want, assuming we weren't doing the metal or the stainless steel ligature ties. Then we can use they're more rubber-like, and they typically come in something like this, and they come in multiple colors. So oftentimes patients will choose what colors they were. I know when I had braces, I always try to coordinate with the most recent holiday that was going to be coming up. So Christmas, I would alternate between green and red. Halloween, I would alternate between black and orange. Valentine's Day, I would do either red or pink. They do also make these in clear, but I would advise not to get clear or white, because they do have a tendency to stain a little bit yellow in color. So the other instrument that may be used as well, this is the bird beak instrument, and the bird beak is also to help form and bend wires as well. So again, with our wire, let me pull that up here. With our bird beak one, we could do the same thing where we can put specific bends into our wire, and hence the name bird beak, because it resembles a bird's beak. So we have our wire on, so it's time to put our elastomerics back on. And let me see, I did have that in, here it is. So this would be what your book calls the ligature tying pliers. As you can see, it somewhat resembles the hemostat. It is serrated again to provide a much better grip. So this is something that can be used to place the elastomerics back on there to keep that arch wire in place. So I'll kind of do a few here. And like I mentioned, it does click again to lock it in place, so I'm not having to squeeze it to hold it. It's, you know, by locking it, it's holding it in place. So very careful here, if I can get it in the picture. So again, with this, it's more of a challenge because these are so bulky, but you want to make sure that that arch wire is in the bracket fully. Let me see if I can maneuver this here. You would put it on one end of the bracket. Let's see if I can get this on here. So I was able to get that on. Let me kind of do a few more here just so you can kind of see again. So you take that off. We'll come to this one right here, and same thing, making sure that my arch wire is in there. Sometimes you have to kind of hold it in place. Place that around. Once you get it around there, you unlock it. And with these ceramic brackets, like I mentioned, because they are so bulky, it's, let me see if I can move the camera up here a little bit more. You almost have to hold with your fingernail kind of in there. Get it around. Once you get it in one area, then it's usually pretty easy to get it in there. But you kind of want to grab more towards the end so you have a little bit more of the ring showing, which then kind of makes it a little bit easier. Get that arch wire in there where it belongs. Come down a little bit more. And again, you always want to work, when you're doing this, you always want to work away from the gum tissue, because in case, like I mentioned before, if you happen to slip, then you're not going to injure the patient. This is something that definitely, and these teeth are coming out as I'm trying to do it. So these teeth are already moving. This is something that definitely takes a lot of practice when you're first getting into ortho. Okay, so I got those on there just like that. So again, it's holding the arch wire in place. I'm not going to do the rest of those, but you can kind of get a sense for what that's like. Another thing that is going to be used is something called the power chain. And again, it comes in different colors. And it's basically continuous O's. I don't know if you can see that very well. And this is meant to close spaces. If you've ever had a power chain, this is not very comfortable when it's on. It puts a lot of pressure on your teeth because it's moving them all together. So that's what it's primarily used for, is to close any space that might be there. So same thing as you did with the elastomerics, the rubber-like elastomerics. You're going to do the same thing. And what I always like to do is I take my pin and ligature cutters. It kind of has a curved end on that side and a very flat end on this side. So if I were to turn it this way a little bit, you can kind of get a better sense for what it looks like. I would always chop off the very end of that one. So I'm kind of chopping it off right in between the chains. So I'm going to kind of stretch it out. It helps to sort of stretch it out a little bit more, makes it a little bit easier to place. And then you can see these anterior teeth here on the lower. We're going to say we're going to close some of those spaces. So same thing, except you're not really using any kind of instrument. It's usually just your fingers that you're doing it with. And same thing, you're wanting to get it around each of those brackets. And it's 1 per tooth is what you're trying to do. And you have to kind of maneuver it a little bit and manipulate it. And that one broke there, so I would have to start over because it broke. But then I was almost done. I had one more, so if I just kind of continue on to this one, hopefully it doesn't break. That's why it does help to sort of stretch it ahead of time to prevent that from happening. So once you have it on there, you would take your end pin and ligature cutters again and kind of cut it off in between. You want to stretch it out. And these are pretty dull. They have been used quite a bit. And it would cut it off just like that. If you find that there's an area where it wasn't quite around the entire bracket, then you would take your Explorer, or preferably your Explorer. It's a little bit easier to use, to again kind of be able to manipulate it up and around so that it's around the entire bracket of the tooth. Now again, this one broke, so it should, I would have to do this over, but just to kind of get a sense for what that looks like. So it's 1 basically per tooth, and it makes it very, very tight for the patient. They definitely feel it. And then once we're done with the patient, then what we would do is, last thing would be to make sure that we cut this excess arch wire that is sticking out on either side. That's going to be very uncomfortable for the patient. It's going to irritate their cheek. Their tongue's going to be playing with it. So that is where your end cutting or distal cutting pliers are going to come into place, and then you would insert it into the mouth. Do it as close as you can to the tooth or the bracket or the band if there was a band. And again, same thing, you snip it off. You always want to make sure that you don't let go of that little piece of metal that you just cut off, because you don't want the patient to swallow that. So you always want to make sure that that's there. You do the same thing on this side. Cut that off, make sure the remainder of that wire is there, and then you are good to go. One thing I always did with my patients, just to make sure, is I would always just kind of feel back there just to make sure it was okay. If I was still feeling somewhat of a, if I could still feel it, then I would cut it a little bit more if I could. Do a little bit more on this end. So that way it's much better for the patient. They're not going to feel it. It's not going to irritate them. One thing we can provide to our patients is some wax so they can stick back here in the event that it starts to poke or irritate them. Then rather than having to come in all the time, they can place a little bit of wax back there to prevent some irritation and poking from occurring. Same thing with the brackets themselves. Sometimes the lips, inside of the lips, will get a little irritated, where they can definitely place some wax along those brackets just to protect the lip a little bit, at least until it heals. So that's kind of what ortho is all about. It's especially ortho assistant, your job is to change out the ortho wire. Once the dentist tells you which wire you're going to be doing, the dentist or orthodontist is going to do the bends in the wire, and you will be placing the wire back in. You'll be placing the elastomeric or metal ligature ties, depending on what it is that you're trying to achieve and do, and making sure that you're cutting any excess off the arch wire in the back so it doesn't irritate the patient, and making sure again that when you're placing it into the arch that you're putting that dot or that indicator for the midline right between the two front teeth, to make sure that your arch wire is going to fit appropriately. So that is what ortho looks like for an ortho assistant when you're working on your patient.